Well, as our loved ones age, it's so important to keep up physical strength to prevent those injuries. But where do we start? We have Carolyn Richardson from PACE Guide to Senior Housing and Chris Sear. He's a physical therapist with Sunrise Home Health, and they're here to give us some great information. Carolyn, should we look at weakness as sort of a normal sign of aging in our loved ones?
Age-related changes is normal. However, a rapid, quick debility is not. But either scenario can be helped with strengthening and working, doing rehabilitation. Things like that could definitely help that weakness and that strength.
And what's available to help people really combat that strength decline?
So there's a few hospital situations, which would be a skilled nursing facility, a post-acute rehab, at home with home health, or in outpatient therapy. Chris Sears is actually here from Sunrise Home Health. He is a physical therapist, and he goes into people's homes to help them strengthen.
I think that's fantastic. Chris, tell us a little bit about the program that you offer.
Well, typically, excuse me, we'll go into a home and we have the patient's medical history, and we make a formal assessment in the home. And a couple of things that we're looking for is safety, if there's any equipment needs, if the home needs to be adapted in any way. And then beyond that, we do a functional evaluation to determine if there's what deficits, what impairments are keeping people from functioning independently on their own.
Yeah, I love that. So if somebody gets off balance and they have a tendency to fall, then you work on that physical therapy aspect to make sure that that doesn't happen. It's very targeted, isn't it?
It is. You know, I think the most important thing is to train specific. And so when we find that people have a weakness or they're having difficulty, say, getting in and out of bed or up and down from a chair in their home, then we want to create an individualized program for them to help with those particular deficits and train those particular muscle groups that are going to help them function at a higher level and more independently.
Yeah, absolutely. I mean, people could really benefit from physical therapy at home, can't they?
Absolutely, yep. And I think that, you know, whether you've just been discharged from the hospital or, you know, if you're just feeling like you're not able to do the things that you were doing before, yeah, it's a perfect time to implement physical therapy, and we can come in and help out and get improve that independence and restore that mobility.
Absolutely. Carolyn, there's a place that you're going to talk about that that could really help. It's called Lifestream at Cook Healthcare. Tell me about that.
Absolutely. So PACE is pleased to spotlight our sponsor, Lifestream at Cook Healthcare, is a 5-star rated Medicare and Medicaid certified skilled nursing facility committed to providing compassionate service and health care. Residents enjoy a range of nursing services, social activities, and recreational programs geared to each resident's needs. In addition to long-term care services, also includes short-term care, rehabilitation, memory support, and respite care. With an emergency call system in the bedroom and bathroom, staff on duty 24 hours a day, and ongoing background screening and drug testing for all our associates, you can leave your worries behind. Now in its 40th year as a faith-based nonprofit, Lifestream Complete Senior Living is compelled by Christ's love to provide compassionate care and community to enrich the lives of their seniors.
Great information, everyone. Lots of choices, and it's so good to know that you're both out there. Thank you so much.
Thank you.
And for more information, everyone, go to seniorhousing.org or call the number right there on your screen.